Hello, everyone. Can you hear me?
We can.
Okay. May I have my slides, please? Are they up? Thank you so much. First, I want to just say thank you so much to Dr. Roberts. What an incredibly compelling, powerful, and moving testimony you gave. Thank you so much for laying the historical groundwork for us here. I also want to thank the task force for this also just incredibly powerful work that you are doing. Thank you so much for your continued commitment to the well-being of Black people, to African Americans, and thank you for doing this for the culture. I so deeply appreciate this, and I'm honored to be here. Next slide, please. So what I want to do today is tell a story. I want to tell us a story about health inequities among Black Californians in particular. Try to connect this story to the history of chattel slavery and to the present of anti-Blackness. And then try to bring us into a bit of a discussion of what repair might look like. I know that that is absolutely your charge and you are much more expert than I am, but I wanted to share a few ideas about how I think we may be able to move forward. Next, please. So here, these are just some data on the incredible racial and ethnic diversity that is present in the state of California. And you can see here that Black people in the state of California represent about 6% of the population of the state of California, and that has held true for the last several census and is projected to be the case up to 2040. Next slide, please. However, you can see here that although Black people only represent 6% of the population of the state, Black people are overrepresented among people who are living in poverty. So that's the second bar there, where you can see that Black people, 13% of all Black people in the state of California live in poverty. And even all the way up to up to 299% of poverty, you still see up to 50%, approximately 50% of the population in California, Black people in California living relatively close to the federal poverty threshold and venturing just a little bit above that. And so I think given the history of chattel slavery and the forced labor and certainly the extraction of labor without being compensated, that we still see some of the profound implications of that in the present in terms of socioeconomic status among Black people. Next, please. A shorthand that we often use in social welfare and in public health is that Black people live sicker and die younger. And unfortunately, that's what we see here. The life expectancy of Black Californians is still much lower than other Californians. And so you can see here on average, a Black Californian would live 75 years. And so especially as I'm getting up and up in my own years, I start to think, 75 years is not that long, and start to think about the ways in which, again, these structural arrangements or the intergenerational impact of slavery, the profound biases that are built into the system, our healthcare system, as well as the fact that Black people do not receive the same kinds of returns to education as white people, as their white counterparts. So you see here that there is a profound impact, it's literally on the physical body of Black people in terms of life expectancy. Next, please. So I apologize, these are a little bit small, but these are just another way of telling the story about Black people's well-being, again, in the state of California. So here you can see in this chart, preventable hospitalizations by race, that Black people, this is so small, I really apologize, but Black people tend to do worse in terms of all of these outcomes. So you have asthma, diabetes care. This is asthma for Black children as well as Black adults. Angina. These are all conditions that can be prevented and treated. On the outpatient side, Black people tend to do worse in all of these dimensions compared to white Californians. You can also see here that this bar graph on the far left here, the blue bar is that represents Black people in the state of California who are much more likely to be readmitted to the hospital for conditions that were not adequately treated during the first inpatient hospitalization. And so here, you think about some of the issues that Dr. Roberts also mentioned about pain management, about biases that are deeply embedded within the healthcare system itself. And so you can see that Black people are deeply affected and deeply harmed by these biases. Next, please. These two graphs show similar outcomes. So you can see here that top graph is cancer early diagnosis. That is for breast cancer. And so that you can see that that Black women tend to be diagnosed a little bit later. Actually, Asian and Pacific Islander women are also diagnosed later as well, later than their white counterparts. And if you move over to the other chart, cancer deaths, you can see here that in all of these particular outcomes, particular cancer sites, breast, cervical, colorectal, lung, and prostate cancer, you can see that Black people also suffer overwhelmingly disproportionately higher rates than their white counterparts. In terms of even for cancer deaths due to prostate cancer, Black men are dying almost at 5 times the rate of white Californians. And so these are, again, literally coming down to matters of life and death. Next, please. Another issue that Dr. Roberts also touched upon for us was the issue of maternal well-being. And I think we've been frequently have heard of late in the media the ways in which Black women, Black people are treated in the prenatal and birthing outcome space. So Black women tend to not do very well in terms of getting sufficient prenatal care. In the first trimester, Black babies, you can see here, are also much more likely to be born preterm, and that puts Black children at risk for all kinds of additional health problems later on, including infant mortality. And so these maternal health and infant health outcomes taken together really sort of set the stage for Black well-being or Black ill health through the life course. Next, please. Here you can see the low birth weight and infant mortality outcomes for Black children, and you can see the blue bar here at the far left on both of these graphs represent Black low birth weight births and Black children who have died before their first birthday. And so here again, in these data are from 2020, I believe, we still see these much different outcomes for Black people compared to other people in the state of California. And the state of California is considered to be a very progressive state. And we know that even in a very progressive state, that the inequality and the inequity and the biases that really began during the transatlantic slave trade, we see those, that they persist quite strongly in the present. Next, please. And here, maternal mortality. So the United States in general ranks very low, does very poorly in terms of maternal well-being and maternal health outcomes. And here you can see that Black women in California tend to die at a higher rate than their other California counterparts, than their white counterparts in particular. And this is something that I think I have been touched by personally. Much of my work is actually about how these differences in treatment persist across class, and so this is not only about poverty of African American women living in poverty, but these outcomes tend to persist across class, meaning that Black women with college degrees also are affected by this and have higher rates of infant mortality for Black women with college degrees, even compared to white women with high school diplomas only. And so we know that this is not only an issue of class, this is absolutely an issue of racism and sexism and the combination thereof called misogynoir. Next, please. And this is the last data slide here, but I wanted to show that, we know that in California, housing is a huge issue. And this is something that the state, I know, it has been grappling with. But just to think about the incredible disproportionality of Black people living on the street in the state of California, the 5th largest economy in the world, Black people are overwhelmingly more likely to be homeless than white people, white Californians, Asian Californians, and others. So you can see here that the rate of homelessness for Black Californians is about 172.7. For other people, for white people in California, it is 28.9. So this amount of disproportionality is it's profound. And I think we really need to think about all of the structural reasons that Black people are so much more likely to end up living on the street compared to others. Next, please. So certainly, as others have mentioned, Dr. Roberts has mentioned, many people have documented the relationship between slavery, the afterlife of slavery, and anti-Blackness. Of course, W.E.B. Du Bois is known as a sociologist, and sociologist and historian, but his work also he used very rigorous empirical methods to demonstrate the relationship between Black people's poor health and slavery, the afterlife of slavery, and the ongoing discrimination that Black people faced, particularly in his study, The Philadelphia Negro, and in the health and physique of the Negro American. Very importantly, W.E.B. Du Bois pushed back against the dominant tropes and explanations at the time, the pseudoscience at the time, that suggested that somehow Black people were simply biologically different and therefore biologically inferior, and this is why we were dying younger and living sicker. And so this work is, taking place. This work is published at the turn of the last century, and so it really is, as others have mentioned here today, the time is now. We have known about this for a long time, and it's really, I think, a matter of political will and power, and that's why I'm so grateful that you all are thinking so carefully about how to do this. And next, please. So just as we're trying to think about ways to repair this, I know this is your charge, but when I was asked to appear before you, it really made me think expansively about this. There are some, I should say, reparation strategies that already exist. Evanston, Illinois, in terms of housing reparations, I think was the first city to try to do this. The Claims Conference providing monetary compensation to people who were descendants of Holocaust survivors, and of course CARICOM. There are many ways to try to think about this, and I think taking an expansive view is critical. Next. So in addition to establishing some sort of financial system, if that is indeed where you decide to go as a committee and as a task force, I do just want to mention that I think it's really important as we think about the implications of slavery that we also really think about ceasing the ongoing harm that we all face here as Black people in the United States, particularly the ongoing consequences of slavery and anti-Blackness in terms of punishment, prisons, and police violence. This is a public health issue that is often overlooked in much of the data that I presented, but the implications of imprisonment on Black people and Black health is enormous, and I think we would do well to really consider that. And then to acknowledge and to not shy away from the very close causal relationship between anti-Blackness and poor health. Next. I also would be remiss if I didn't address or suggest that one of the ways to try to do something about health is to deal with both the social policy and social determinants of health that actually contribute to health, that really are the things that make us either healthy or not healthy. And so to think about using both universal and targeted approaches to expanding the safety net. We know that Black people are very vulnerable to, not having health insurance, to being unhoused. Black women typically, not having childcare subsidies is a big deal, and not having sick leave. And I apologize for the typo there. But these kinds of social policy issues would go a long way to improving Black people's health overall. Next. And just to close here, I wanted to just leave with this, that I really believe that a multifaceted approach that addresses both social determinants of health and anti-Blackness is critical, and that, another world is really possible. And I appreciate so much all of your efforts to usher in that new world. Thank you.